Real Doctor, and on this video we're going to cover real treatments that doctors claim can make a woman's sexual experience better. Do they work, and are they worth the risks? Let's find out. Vaginal rejuvenation is a catch-all term for treatments that help a woman supposedly improve the health and, in some ways, I guess, the function of the vagina. These treatments are advertised to create a tightening effect to the vagina, to increase lubrication, and to improve the sexual experience. But for who? The man or the woman? There are also claims that these treatments can improve urinary incontinence. So how do they work? Well, in general, these treatments are separated into two types. They're the lasers and the radiofrequency treatments. Some common names for the laser treatments are the Mona Lisa Touch and the FemiLift. And these laser treatments function to actually burn tiny columns of tissue inside the vagina. By doing that, the belief is that the vaginal walls will heal in a tighter fashion with more lubrication. Radiofrequency treatments go by the names of Thermiva and Viviv, and these treatments do not necessarily burn the tissue like laser treatments do, but they create a deep heating using radiofrequency energy. Now, it's important to realize that these devices are not FDA cleared for this use. Typically, they have FDA clearance for uses that are not the same as vaginal rejuvenation. But it doesn't mean that it's illegal for doctors to use them for that purpose. For example, the lasers are FDA cleared for the removal of lesions inside the vagina. But doctors can use them legally off-label in order to create that vaginal rejuvenation effect that they are seeking. So do they actually work to create these changes? Will a woman have increased lubrication, increased tightness, and a better sexual experience if they get these treatments? Well, there was a study published in 2021 in JAMA, and this was a sham-controlled, double-blinded, randomized clinical trial that included 90 women with postmenopausal vaginal symptoms. After 12 months, the treatment group, who received a fractional laser treatment to the inside of the vagina, had the same results as the sham group, which did not receive that treatment. Now, this study did not show that the laser treatments created a vaginal rejuvenation effect, but there have been several other smaller studies that have shown a successful result. So what do the medical associations say about vaginal rejuvenation lasers and radiofrequency treatments? Well, according to a statement made by the American College of Obstetricians and Gynecologists, patients should be made aware that surgery or procedures to alter sexual appearance or function are not medically indicated, pose substantial risk, and their safety and effectiveness have not been established. In 2018, there was also a warning statement put out by the FDA in regards to these treatments used for vaginal rejuvenation. So what do I think? Do vaginal rejuvenation treatments work if you're postmenopausal and you're having issues, let's say, with dryness and sensitivity? Should you do these treatments? Well, my recommendation would be to start by talking with your gynecologist to see what is the best treatment for you. Sometimes topical treatments like topical estrogen creams may be all that you really need to get the changes that you're looking for. And if you do consider getting one of these vaginal rejuvenation treatments, then I would recommend going for the radiofrequency ones that do not technically burn the inside of your vagina versus the laser treatments. The G-shot, as silly sounding as that is a treatment that has been around for a long time. And it is the injection of hyaluronic acid filler into the G-spot as a way to improve, supposedly, a woman's sexual experience. Now, the G-spot, if you don't know, is the Grafenberg spot, and this is an actual anatomic location that is believed to be inside the vagina, typically on the front surface inner wall of the vagina. And the belief is that this is an area where you have a cluster of nerves that can create better sensations for the woman during a sexual experience. Now, there was a pilot study done by the doctor who invented the G-shot, and that doctor found that 87% of the women that underwent the G-shot had an improvement in their sexual arousal and their sexual experience. And these results appear to last anywhere from 4 to 6 months. Now, the idea is that you're injecting filler into the G-spot, causing that G-spot to enlarge in size, and that supposedly improves the sexual experience. But I would keep in mind that this is also not an FDA-approved treatment, that there have been no other studies that I know of other than the pilot study done by the inventor of this technique, who sells this technique to other doctors as a way to make money. So I would really exercise caution, in my opinion, with this treatment. I would consider the next treatment maybe first. The O-shot is the injection of PRP, or platelet-rich plasma, into multiple areas of the women's private parts. This includes the clitoris, the labia, and the G-spot. The claims that are made about the O-shot is that it can potentially increase arousal, it can increase the orgasm experience, and it can improve lubrication. And the idea is that the platelet-rich plasma is filled with growth factors, and when you inject those growth factors into those areas of a woman's genitalia, that can cause them to essentially be supercharged in a way. So what does the science say about the O-shot? Like the G-shot, the only study that I could find with the O-shot was done by the inventor of the technique. And of course, the inventor of the technique has a financial incentive to have good results so that doctor can sell this treatment to other doctors for a profit. This pilot study was performed on 11 women, and they found that 71% of them went from distressed to not distressed. And there have been more recent studies in the literature that do appear to show that injections of PRP into these areas of a woman's private parts may have a positive effect, like they're claiming. So if you're going to try either the G-shot or the O-shot, if I had to pick one, I think I'd go with the O-shot, because PRP is from your own body, and the risks of the injections are most likely going to be a bit lower than if you're injecting a hyaluronic acid filler. So I implore you that if you're going to consider any of the treatments I've talked about in this video, talk with your board-certified gynecologist about it. Please do your homework and only do those procedures that you are 100% confident are the right thing for you to do. You do not want to make mistakes with your body. And speaking of mistakes, we talked a lot about women's private parts plastic surgery on this video, but what about men? On this video right up here, I go over 5 of the biggest penis enlarging mistakes that men make. Check it out right up here. And remember, eat real food, use clean skincare, and auto-juvenate before you operate.